First of all, thank you, Madam Chair and members. Proud to present AB-2079. This committee has spent significant time over the last couple of years working to improve the care that nursing home residents receive. I'm proud of much of the work we've done, but we still need to do more. This bill makes some noteworthy and important changes in how skilled nursing facilities will manage their money, and it will improve the quality of care that residents receive. The bill requires a facility to spend 85% of its total revenues on direct patient care, much the same way that insurance companies are already required to put 85% of revenues into patient care through the use of medical loss ratios. Direct patient care includes, and appropriately so, staffing, wages, benefits, therapy, supplies, pharmacy, plant operations, and maintenance, laundry, and dietary. All of the things that directly benefit a resident of a nursing home. Non-direct care won't count towards that 85% spending requirement and includes administrative costs, executive wages, payment to management companies, home office expenses for parent companies, and profits paid to contractors or related party entities, among other things. We had a comprehensive interim hearing last October on licensing of skilled nursing facilities and heard much about what are called related parties during the testimony and how they can siphon profits out of these facilities, money that could have and should have been spent on residents. For example, I don't want facility owners taking advantage of loopholes that allow companies that own, say, 5 facilities to use a related entity they also own to bill thousands of dollars every month in administrative fees, or use a laundry company they also own to bill each of their facilities what may be over-market fees for services. The bill builds upon existing requirements for the Department of Healthcare Services to audit nursing home medical spending, and for those facilities to report financial information to the Department of Healthcare Services and Information. The bill requires the two departments to look at the information when reviewing the facility reports on revenues and then decide if the 85% spending requirement was met. If not, DHCS, which already has a mechanism for clawing back Medi-Cal payments, and the Department of Public Health, which licenses these facilities, will require them to provide rebates to the payers, Medi-Cal, Medicare, or private insurance companies, similar to the MLRs we require of insurance companies. I'm going to stop here. I'm going to give my 2 witnesses to cover anything I've missed. We have with us today Charlene Harrington, is Professor Emerita, University of California, San Francisco, representing the Geriatric Circle, an informal statewide group of academic geriatric experts. That's a mouthful. Tony Chicotel with the California Advocates for Nursing Home Reform. Ms. Harrington has done important research in this area and will be able to tell you just how profitable these facilities can be. Please begin whenever you're ready.
Thank you very much. The Geriatric Circles strongly supports AB 2079 because this bill would have the effect of shifting an additional 21% of revenues into direct care, or close to $1 billion in California. We think it would have 4 major benefits. First, it would encourage higher staffing levels and wages. And we know that many nursing homes in California have had a history of inadequate staffing, and this has been associated with higher COVID-19 resident infection rates and death rates, and many other serious quality problems. Nursing home staff wages continue to be low, and turnover rates are as high as 50%. The second benefit is that it would control excess profits. Even though patient days and occupancy rates in California nursing homes dropped in 2020, the profits of nursing homes were 6%, and some nursing homes even had 15 to 30% profits. We also know that California Medi-Cal reimbursement rates are adequate because the daily rates are 91% of Medicare rates in 2020. And of course, the daily rates for Medicare should be a little higher because those are for post-acute residents that require more rehab and nursing care. The third benefit is that it would discourage and reduce hidden profits and hidden management costs, where, as Dr. Wood mentioned, nursing homes siphon this money off into the related party companies. And finally, we think it would encourage reductions in excess property costs. We know that some property owners charge excessive rates to the nursing home companies, and some have lease agreements that have 3 to 5% increases built right into the lease each year, and this pulls revenues away from resident care. In summary, this legislation is similar to legislation passed in New Jersey, New York, and Massachusetts last year, and the bill would ensure greater financial accountability and improved nursing home quality. Thank you.
Good afternoon. I'm Tony Chicotel with California Advocates for Nursing Home Reform and strong support of AB-2079. The timing is interesting here. Just yesterday there was an Assembly budget subcommittee hearing where the nursing home financing reauthorization, the financing system reauthorization was discussed to some degree of length. And here it's virtually guaranteed that the administration is going to propose giving the industry more and more money. Every year they get raises, and every year the quality stays about the same, and it's never been very good. When the current financing system was set up in 2004, there were big promises made that, hey, we get more money, you're going to get better care, things will improve, and that just has not happened. I'm really excited about this bill, which would be a major reform to establish a direct care minimum expenditure. As Dr. Harrington mentioned, other states have done this. The pandemic has been devastating to the staff and the residents in facilities, and it's time that we really roll up our sleeves and get real reform. And we started last year. We had 4 bills that were very reform-oriented passed last year, part of the PROTECT plan. I think we have some more work to do. I think this bill goes a long way to doing that. And if you're all interested in seeing what we're getting at, you might want to take a look at a lawsuit that was filed in New York State at the end of 2021. New York is ahead of us. They passed this law in 2020 where they're requiring 70% of the revenue be spent on direct care. And in this lawsuit, the nursing home, 238 nursing homes banded together to try to stop the implementation of this law. And in their own complaint, they talked about an average of $3.5 million per nursing home being spent on things that were not direct care and were beyond the amount allotted to them by the state of New York for non-direct care. $3.5 million per facility. That's real money that could help a lot of residents. So we urge your support for this bill. Thank you.